there are some developing countries which have achieved universal health care. Traditionally, one of the best examples used to be Costa Rica. But you don't have to go that far. One of our neighboring countries have achieved universal health care. That's Thailand. Thailand introduced about 20 years back universal health care. Is working reasonably. So it is possible, even for developing countries, to carry out universal health care. And universal health care should have helped the business people as well. So, for example, countries that have universal health care gets the support of the business because when they unlike in the United States, when they are competing with another country in some marketing some products, they don't have to worry about, they have the advantage that they don't have to provide the job for the additional labor. They don't have to think about their healthcare because the state does healthcare. So businessmen don't have to. Unlike in the United States, because in the United States, if you're thinking of hiring an extra labor, the marginal cost of labor includes the healthcare cost of the whatever minimal healthcare that business pays you. So it's job related. So it hurts the labor hiring cost of business, which the Swedish employer doesn't have to worry about. So in that sense, Sweden has an advantage over the United States because they have universal health care. This is an advantage not just for workers, it's an advantage for business. And yet, anybody talks about universal health care in the United States or India, much of the time, business people are hostile to universal health care.